Now, it is my great pleasure to once again introduce Dr. Wendy Wright discussing vaccine hesitancy.
Hello, everyone, and welcome to this program entitled From Vaccine Hesitancy to Vaccine Confidence, Effective Approaches to Patient Communication. My name is Dr. Wendy Wright, and it is my pleasure to bring this program to you today. I am an adult and a family nurse practitioner and the owner of 2 nurse practitioner-owned and operated clinics. I will also tell you that this lecture is truly one of my favorites because this is what I spent 3 years in my doctoral program working on. Not only how to help communicate or help providers to communicate with their patients about vaccines, but also how to take vaccines and incorporate them into traditional workflow and to try to optimize those vaccination rates. I think you can all agree that never before in our history it's so imperative that we be able to communicate with our patients about vaccines and the efficacy and the science, but also how do we communicate with them to get them to move from not necessarily wanting to get a particular vaccine to making sure that they do get vaccinated. So I hope to bring you all of that information today. What you are seeing here, as you will see and have seen with every lecture I do, are those companies that I have been affiliated with in the last year. I will tell you that most of my work with these companies is in the world of vaccines. But again, this program is not designed to really talk about a particular vaccine, but to really focus on communication and how to improve our vaccination rates. So we're going to talk over the course of 75 minutes. We're going to talk about the impact of vaccine confidence on immunization rates and outcomes. I'm going to review suggested approaches to discussing immunizations, not just with parents, but with our patients, our adult patients as well. And then I've given you a few case studies at the end, because what I've heard from a lot of NP colleagues that I've delivered this program to is that they love to take this program back to their triage nurses or the nurses in their office or even the medical assistants to be able to give them some talking points on how to communicate with people in an evidence-based way. And again, the way I communicate with people may not be the same way that you do, but what does the evidence say works when a person says X, Y, and Z to you about a vaccine? So here's our table for the day and our outline about what we're going to talk about. We're going to talk about non-medical exemptions, what we often refer to in the business as philosophical exemptions, or even religious exemptions, and what impact do those type of exemptions play on some of the outbreaks of communicable diseases here in this country. I want to talk with you about the range of parental as well as patient attitudes. If they are this type of person, what impact might that have on their vaccines and acceptance of vaccines? We're going to talk about presumptive language versus participatory language. And it's called a few different things in the immunization literature, but what impact does it have, or what impact on vaccination rates does presumptive versus participatory language have? I want to demonstrate the impact of vaccine confidence on immunization rates and outcomes. I'm going to give you some talking points. If a patient says X, Y, and Z to you, what can you say to them based on the science? Give you some role playing if you want to do that with some of your colleagues in your clinic, and some of the resources that are out there. I've given you 3 or 4 slides actually that have some great resources on vaccinations and communication around vaccination. So let's start with bullet number 1, and let's define the problem in terms of non-medical exemptions. What I'm showing you here on this slide is 2016 and the way the United States worked looked in terms of religious versus medical exemptions, etc. Now, I will tell you, this changes every year, and I don't think it's imperative that you find your state because things change over time. But I wanted you to see this 2016 because I'm going to show you the impact that this map and those exemptions had on the measles outbreak of 2016. So let's talk about the different types of exemptions. And the first exemption is what we call a medical exemption. And every state in the United States has medical exemptions. If you had anaphylaxis to this particular ingredient, then you are obviously allowed a medical exemption. Or for instance, if you've just had a bone marrow transplant, every state allows medical exemptions. And almost every state allows religious exemptions. And that is the person who says, I am a Christian Scientist. I do not believe in vaccines. And by the way, that is the only religious group that does not endorse vaccinations. And then some of the states allow what we call personal belief exemptions. And those are the people who say, I just don't believe in vaccines at all, and I just don't want to get them. So when you look at the states, in 2016, there were 3 states that allowed only medical exemptions. They actually blocked religious exemptions as well, which is pretty interesting because most states don't do that. When you look at the purple states, and this is where my state is, my state allows for religious exemptions, but does not allow for personal belief exemptions. And last, the green states are those that allow both religious as well as personal belief exemptions. So when we take a look at the measles outbreak, one of the biggest that occurred in 2015. Some of you remember this. It was often referred to as the Disneyland religious exemption. But in any event, when we look at the measles cases in 2015 in a 4-month period, here's what we saw. About 43% of the people that contracted measles during that measles outbreak in those 4-month period, 43% of them were non-vaccinated because of a philosophical, or often referred to as personal, but philosophical or religious belief. There were 40% that were ineligible, meaning they were too young to get the vaccine at that time. About 4% had missed opportunities. They should have been vaccinated. They were seen in a clinic, but it just didn't get offered to them. And then we've got 13% that have other. So why do I have this slide here? Because you can see that of the 68 US residents with measles who were unvaccinated against the disease, 43% of them were unvaccinated due to philosophical beliefs or religious exemptions, the largest number. So we know that these absolutely play a role, and most of them were the philosophical belief. Every year, I am the nurse practitioner representative to the State of New Hampshire Immunization Advisory Board. And we are what I call a universal access state, which means this: the state of New Hampshire provides vaccines to every child, so to providers for every child under the age of 19 for every vaccine. So what happens in my state is I don't have to pay for vaccines for children under the age of 19. I place my order with the state and they ship me the vaccines. We certainly have to meet certain criteria. We have to fill out all kinds of paperwork. We have to let them know who we're vaccinating, but they're provided to us. I will tell you that every year our advisory board is inundated with bills that are being filed in the state legislation or with the legislators to try to increase philosophical exemption ability, to try to allow those philosophical exemptions to become part of our state. And we've managed to kind of keep those bills down, but it's a moving target. And we have people in the state, I could give you their names, who I know are some of the biggest heavy hitters in the anti-vaccine movement. And they are the ones every single year who are submitting for these laws. So I tell you this because A, every state is a moving target. There are lots of anti-vaxxers out there who are wanting to get those philosophical exemptions onto the books in the state to allow people to walk into a clinic and say, I'm not going to vaccinate my kids, and I want you, and I'm going to provide a letter to the school that it is against my philosophical belief. Today in the state, I do not have to endorse that. And the only reason that someone could be exempt from vaccines, if they're mandated in the state, is either religious or it is medical. So for instance, in my state now, every child that attends a public school system must be vaccinated against varicella. We don't have a lot of mandates in our state, but they have to be mandated against varicella. They have to have a Tdap by the time they're in 7th grade. Those are pretty much our big mandates. But if they choose not to do that, and it's their philosophical belief, they are not allowed to be in the public school system. So this is really the role that some of these mandates play. And when people say to me, the government has no right to mandate that my kid be vaccinated, the government actually does have that right, and they have the right to mandate that we are vaccinated. They often don't, but it's the same philosophy as mandating that everyone under 18 wear seatbelts in my state, or that people who ride a motorcycle in Massachusetts have to wear a helmet. The government absolutely has that right. They often don't exercise it, but they certainly do have that right as well. And a lot of states have put mandates in place. Again, I live in New Hampshire. Our motto is live free or die. And die it is. So we don't have a lot of mandates, but those of you who live in states where the kids have to receive 2 MMRs or they have to be Hep B vaccinated, the government absolutely has the right to do that to protect the greater good, is their philosophy. You can agree with me or not agree with me, but that is the truth and that is the reality behind it. So there was a couple of studies that have been done about parental or people's attitudes toward vaccines. And this was a study that was done with moms. And the reality is, when you talk to me about vaccines, I can name for you off the top of my head the 5 or 7 or 10 families that come to my clinic that are anti-vaxxers and will not give their kids or themselves any vaccines whatsoever. The reality is, while those are the ones that I remember, the majority of people in the United States are actually going to take the vaccines. Now, there's a range of attitudes, right? And we've all seen those. Most US parents want their kids vaccinated, but they differ in their attitudes. So about 33% of all women and moms in the United States are what we call immunization advocates. These are the women or men who walk into your clinic and say, give my kid every vaccine. I think they're really important and I want them. Well, this was my mother. My mother stood in line with my sister. My sister was born after the smallpox vaccine was no longer given out. My mother stood in the pediatrician, actually it was a physician assistant's office, and said, give my daughter the smallpox vaccine. And he said, ma'am, I can't give it to your daughter. It's no longer even available to me to give to your daughter. But that was my mom. My mom would say, any vaccine, give it to my kid. She was really an immunization advocate. And maybe that's where I get it from. There, about 24% of people are health advocates. They want to be healthy. They will do what they need to do. They're not going to come in and march and say, I want all these vaccines, but they'll say to you, please, whatever you think I need to be healthy, tell me what you recommend. And they're going to do that. There are what we call the go-alongs to get-alongs. That's about 26% or so of parents or moms or patients, and they will do what you recommend. And, I often refer to vaccines, but let me back up the bus. If you look at the immunization advocates, the health advocates, the go-along to get-alongs, and the fence sitters, all of those people will take vaccines if you make the recommendation. I often refer to vaccines as what I call a timeshare approach. That's my approach to vaccines. If any of you have ever gone on a vacation and you sign up to see a timeshare, it's a really big sales sales pitch, right? And the reason that they push you to sign on the dotted line while you're there looking at that timeshare is they know you're not going to get home and go, darn, I should have bought that timeshare in Hawaii. Even though I know I'm never getting back there, I should have bought it. So I'm going to call up and buy it. That doesn't happen. And the same is true with vaccines. If you make the recommendation while people are there, you can see that the vast majority of them are going to vaccinate both themselves as well as their kids. There was a study that if you or someone in your office recommends the influenza vaccine for someone, even if they come in with a negative attitude, if you say, this is what I recommend for you, over 80% will take that vaccine. But what happens so often is we know that someone may be on that fence or that they're going to raise a little bit of opposition, and providers don't make the recommendation to them. So I'm here to tell you that the vast majority of people are going to take your recommendation, but you have to make the recommendation, because if they walk out of your office and you have not made the recommendation, they probably are not going to get the vaccine, particularly the worriers and maybe even the fence sitters who are on that fence, who just need someone who they respect and they trust to say, I recommend this vaccine. And I will say to folks when they're on the fence, I am not recommending for you anything that I don't do myself or don't recommend for my son or haven't given to my son. And I find for me, because I can say that, and a lot of people have known me for years and they've watched my kid grow up in the community, that they understand and they are respectful and they'll say, okay, let's just do it and let's get it over with while I'm here. So the good news is, while in our brain, you and I remember the folks who give us the toughest time on vaccines, the reality is it's between 4%, maybe 5% of the US will not vaccinate. The majority will do it if you recommend it. So there was this additional study that was done to help identify moms and women by their willingness to vaccinate. And I don't love these terms, but this was the term that was assigned in this market research that was done. And the first person is the person over here on the left-hand side. We're going to call her just Smart Sally. Again, I don't love her name, but if you look down bottom, this is Sally, who trusts the nurse practitioner. She trusts her healthcare provider. She has a really good relationship with you, her healthcare provider. And if you say, this is what I recommend, Sally is going to go along with it. How often? 97% of the time. And by the way, about a third of your patients are people like Sally. So when you say it's time for your Tdap, let's do it today, it's been 10 years, they're going to take you up on it. They trust you. They respect your opinion. And that's about 97% of people like Sally are going to do what you recommend from a vaccine perspective. Let's now turn to average Abby. Now, there's about 25% of your patients are going to be Abby, and they have an acceptable relationship with you. They're not going to be out there like, they're not going to be out there marching and singing your praises, but they've got a good relationship with you. And people like Abby, if you say, you are due today for your Tdap, 80% of people like Abby are going to take it. Then we get into people like passive Paula. Paula may not even have a great relationship with a PCP or with you, but she comes to you every year. She's there for her 1-year visit. It's not a bad relationship, but it may not be like they love you. But look at people like passive Paula. That's about 22% actually of all primary care patients are people like Paula. I hope they're not my patients. I'd like to think all of my patients are Abby and Sally, but 71% of people like Paula will also take the vaccine if you recommend. Your hardest group of people are going to be people called independent Ingrid. And I'm going to be very candid. Most independent Ingrids are white and well-educated. And I know you know this Some of my worst vaccination takers are my most affluent, most educated white patients. And these people will say that they're distrustful of the system, they're distrustful of the government, and that's about 14% of your patients. They believe that Big Brother is watching, and they're just really distrustful. I'm not a conspiracy theorist, so when people start going down that road with me, I say, you know what? I don't believe in any of that, and I tend to shut off the conspiracy theories because we have way too, I say to them, we have way too many other things to have a conversation about today, and I'm just not a conspiracy person, so we probably shouldn't go there. But people like Independent Ingrid, only 38% of them will take the vaccine as you recommend it. So the good news is the majority of them, even if they don't have the best relationship with you and I, are going to take the vaccine. That's what the market research shows us if you and I recommend it. But here's what you really need to know. Because when I was first in practice 30 years ago, here's what I would do. Your child needs this vaccine. Here's what they need. Today's the day. Let's get it on board. It was literally a 30-second conversation. There was no dialogue. Today, vaccines are 20-minute dialogues sometimes. And the reason is this. They did a survey of 1,000 women who had at least one child under the age of 6. And what I want you to notice is that 60% of them said they feel that even though they're going to take the vaccine, they ought to ask questions about it and they ought to discuss alternative schedules. Is there a way to space them out? Do you think I need to space them out? Is it okay to give them all together? And what do you think? Is that safe? I've heard that it isn't. So that's 60%. So folks, gone are the days of 30-second, this is what you need, this is what your child needs, because the reality is the majority of them feel like they need to ask you questions. So if that's the case, you need to be prepared for the questions that they're going to ask you. Now, I want to tell you about what we did in New Hampshire. We did a survey of our patients or of people who were anti-vaxxers. And we said to them, tell us why you don't vaccinate. Help us as the Immunization Advisory Board to understand why you're not vaccinating. And they told us what we suspected, which was, I'm worried about the safety. I am worried about autism. Pretty common. We knew that that's what they were going to say. But they told us a couple of other things that actually surprised us. And I want to share them with you because I think it's a really good teaching moment. One of the things they told us was, the vaccines you're giving my children protect them against mild illnesses. So why do I tell you that? Well, anyone who's ever seen a patient with polio knows that polio is not a mild illness. But today's generation of folks having babies have never seen polio. So to them, we're protecting their kids against varicella, chickenpox. Many of them had chickenpox. They said it wasn't that terrible, and that's what they think. What they don't think about is rubella and the 10,000 children that were born every year having been exposed to congenital rubella syndrome, who are born hearing impaired and who are born visually impaired with severe developmental abnormalities. What they don't hear about are the 2.7 million people who would die every year if we didn't have a measles vaccine worldwide, because they think of these illnesses as mild illnesses. So that's the first thing that I want you to think about, is when they say to you, well, the reason is these are mild illnesses. I think it's important to put that into perspective because they haven't seen the diseases. But the other thing that was fascinating to us is we asked them, where do you get your information? Who do you trust the most for information on vaccines for you and your family? And who do you trust the least? Well, who do you think they said they trusted the most? The good news? It was me and you. They trust their child's healthcare provider the most for important information. Now, I thought they were going to say the internet and Jenny McCarthy, right? But they didn't. In fact, when you look at the internet, it was around 22%. That's still pretty darn high, but you and I are their trusted source. So we need to capitalize on that, because if we're truly their trusted source, what we need to do is we need to be the authority for them and provide them with evidence-based recommendations. It kills me when I hear our colleagues saying, well, I don't believe in that vaccine either, so why should I recommend it to people? Well, it's not my job to tell people whether I believe it or not. My job is to say, these are the recommendations, etc., and this is what is recommended for your child. So with that said, one other point before I move on from this slide, I told you we asked them, who do you distrust the most? They actually told us, the CDC. Now, I don't know about you, but when I communicate with people, or in the past, when I've communicated with people about vaccines, what I've always said was the CDC recommends. Well, people now associate the CDC with the government. And so when I'm talking with people now about vaccines, what I say is the American Academy of Pediatrics, the American Academy of Family Practice, the World Health Organization, Children's Hospital of Philadelphia, chop.edu, great resource on pediatric vaccinations. I no longer recommend the CDC or cite the CDC because of what they told me. Now, again, this may just be New Hampshire. I don't think so. I don't think so. So just a couple of cool little points as you're going back into your clinic, maybe start saying Children's Hospital of Philadelphia, American Academy of Pediatrics recommends, instead of saying the CDC. The one thing I firmly believe is that vaccines are not just one provider in an office. The office has to be a unified front. And when I interview medical assistants and NPs for a position in the clinic, I ask them, what is your belief on vaccines? Because I've worked for 30 years in my state to improve vaccination rates. I am certainly not going to have a provider in my clinic who goes and usurps all the work that we've done to improve our vaccination rates. It's my belief, and I own the clinic, so I can ask about it. If you don't believe in vaccines, I'm probably not going to hire you as an NP in the clinic. But that's my right, because it's a team-based approach. We also have a nurse who is our vaccine champion. And we appoint, well, she asked to be part of it because she loves it, but she wants to be the champion. So what does that mean? It means that she is the one who updates the entire staff on all of the updates and the recommendations on vaccines. She meets with the different representatives to find out new indications. She always attends the immunization conference in the state. She listens in on the CDC, ACIP recommendation meetings so that every one of us is up to date on the latest vaccine recommendations. And we call her our vaccine champion. We also care plan every patient before every visit with their vaccines. We used to do it manually. We now have a computer program that data mines, and it pulls out their last tetanus, pulls out all their immunizations and their shingles vaccine, their last pneumococcal, and the medical assistant that we've trained to look at vaccines highlights this person is due for this vaccine, this person is due for that vaccine, and we do it prior to every single patient visit before they walk through the door. I call it my 4 eyes, which allows us to look at a chart before that NP even walks into the room. And it's so interesting because we highlight what they're due for, and I'll walk into the room and it's on a sheet that the medical assistant will leave on the counter for the NP. And I'll walk into the room and the patient will say, oh, I know I'm due for the shingles vaccine. I'm here for that today. Can we get it on board while I'm here today? So it starts before the patient walks through the door. We care plan. And then when the medical assistant walks into the room, they leave the sheet there that patients can look at it. It's already highlighted. And then when the NP comes in, we look at vaccines at every single visit, no matter what they're there for. And that way, we don't have to try to get people caught up at their well visits, because you know what? Many kids and many adults don't come in for well visits. So if we wait for those well visits, you saw the impact of missed vaccine opportunities. I think it's imperative. If they're there for their foot pain, look for their flu shot. If they're there for their well visit, look for their tetanus and their pneumococcal, and make sure that you are addressing them every single visit. It takes a lot of the workload off of those well visits. So now let's talk about some suggested approaches to discussing immunizations, not just with parents, but with adults and patients as well. First and foremost, prepare yourself. It's going to be a dialogue. So if you go into it knowing it's going to be a dialogue, yes, I know you're busy. Yes, I know that people bring up 6 different complaints during one primary care visit, but you know what? We have a job to do as well. And so take a deep breath, listen to what they're telling you, identify their questions, and make no assumptions. I've been pleasantly blown away when I walk into a room and I see no vaccines documented. And I'll say, you're due for these 3 vaccines today. Let's get them on board. And they say, okay, sounds good. And it's like, then why has that not happened before? So don't make an assumption. Identify their questions and listen to their concerns. So the slide here says, have a plan in place. I have a plan in place. Our philosophy in our clinic is that we want you to vaccinate, not only your children, but yourself. We're going to talk to you about them at every single visit. We're going to have you sign that you're refusing that vaccine for yourself or your child at every visit. And I'm not going to fire you, but there are many practices, particularly pediatric practices, which tend to be the toughest on families who won't vaccinate, is they'll say at the beginning, are you going to, when they're registering that newborn, are you planning to vaccinate your child? If the family says, no, I'm not planning to vaccinate, the person who registers them, I've heard this, says to them, our philosophy in this office is that every child is vaccinated. We'll give you up to 6 months to get your child vaccinated, but if you do not plan to vaccinate, we are not the practice for you. So I've had some practices say, we'll give them 6 months or we'll give them a year. And I've had other practices, particularly pediatric practices, that say to the family, if you're not planning to vaccinate, we're not the practice for you. We would recommend you find another practice. That's not me, but I know it exists. I've always felt like if anyone can convert these families, it's going to be me, because I'm like a tick on a deer and you're going to hear me at every visit. The reality is the families that don't vaccinate usually terminate their care with us before we terminate them, because I ask them to sign vaccine refusals at every visit if I've offered them. And I say to them, I respect your opinion that you don't want to vaccinate, but I need to tell you what the recommendation is. And I'm going to tell you at every visit. And I don't want you showing up with a malpractice attorney 6 years from now because you chose not to vaccinate and you said I never told you. So if we can come to an agreement that I'm going to tell you, I'm going to recommend, you're going to sign a vaccine refusal, and we use a touch screen. So I drop in a Z code, vaccine refusal by parent or vaccine refusal by patient. And I type in that we discuss the risks of vaccine refusal. And despite this discussion, parent or patient is refusing to vaccinate. Signature below constitutes that we've had this conversation. And despite that, they're continuing to refuse. If you really believe that you don't want to vaccinate and you're strong in that belief, then put your name here. And people who refuse, I say, you know what, we just can't provide that type of care for you then. We'll give you 30 days of care, and you really should find a different provider. I found that, again, very few people, I've not really terminated very many people, because a lot of people will actually say, if you'll work with me, I may not do it exactly on the schedule as recommended by the CDC, but I am willing to get my kids vaccinated. Can we do one dose at a time? And I'll say, yes, it's not my recommendation. And it often causes us to delay vaccines, but I am willing to get your kid vaccinated if you're willing to work with me. And I tailor my advice. Many of the parents will come in citing they want to do a Dr. Bob or a Dr. Sears schedule, where he advocates that one shot be given every month for the first 2 years. It's next to impossible to do that schedule. They'd never stick with it. And by the time the kid is 9 months, they know every time they see us, they're going to get a shot. So I see them pulling into the driveway, and they're like a cat on a door jamb. They see the sign and they're already screaming before they even get through the door, because they know every time they come is torture because they're getting a shot. I just don't like that, but I am willing to work with them if they're willing to work with us. So I talked when I started about what we call the presumptive approach. And a presumptive approach is, you're due for some shots today. Let's get them done while you're here. That's my presumptive approach. Now, there are a lot of ways that you can use the language. I know I'm usually very forthright. You're due for 2 shots today, or your child is due for 4 shots today. It's safe to give them all at once. Let's get them done while you're here and get it over with. That's my presumptive approach. What I'm assuming is that they're going to be immunized today. What does not work is the participatory approach. NPs, how many of you have had a parent say to a 7-year-old, do you want to get your shot today? How many 7-year-olds say, yeah, sign me right on up? That's called the participatory approach. Or by you saying, what do you think about shots? Oh my goodness, you've just opened a can of worms. And participatory, it gives them an out. Don't use it. We know that participatory really doesn't work. And when there's initial hesitance, when I use the presumptive format, come right back at them. He really needs these shots. It is okay. They have been studied together all at once. It's okay. Let's get them on board. This was a study where they compared the presumptive approach from a clinician with the participatory approach. So when the clinician, the provider, said, your child is due for these shots, it's okay to give them. By the way, 74% of those kids were vaccinated that day. When the provider used participatory, how do you feel about how do you feel about a vaccination today? Only 4% were vaccinated and accepted the vaccine. 83%, when the participatory approach was used, 83% resisted the vaccination. That is highly statistically significant. So it's time to start your vaccines. We're going to be doing the MMR and the varicella today. Your child is 1. It's time to do it. So start working on your language. Don't give them an out. They'll still take an out if they want an out, but you need to be forthright and presumptive that they're going to take the vaccine that you are going to recommend for them. And I told you, the majority of them will, if you set the language appropriately. There's another way to approach vaccines. We call it the ask approach. It is considered to be an effective immunization communication strategy. Acknowledge the patient's concerns. Well, I'm worried that that MMR is going to cause autism. Acknowledge it and say, I know people have heard that. Let me tell you what I know about that study. That was completely fabricated. The physician admitted to making up that study. There was a study done in Australia recently looking at 3 million vaccinated children with the MMR vaccine, And there was no increase in autism in children who received the MMR in Australia when compared to children who were not vaccinated. So you need to acknowledge, and you know what I'll say? I remember being really worried about that too when Dylan was little. But let me tell you, steer the conversation. Let me tell you what I know about that study and be prepared to have facts. Refer to reliable internet resources. Go verify what I just told you at chop.edu, Children's Hospital of Philadelphia, and make your recommendation crystal clear. I recommend your child get the MMR at 1 year of age and a booster at 4 years of age. So again, this is called ask, acknowledge, steer the conversation, refute the myths, and know your facts and make your recommendation clear. That has also been shown to be a very effective communication strategy to improve vaccines, not only in children, but also in adults. How many of you have heard this? Tell me what your worry is about the COVID vaccine. Well, I'm worried it's going to get in my DNA and it's going to change my DNA. You know, I've heard that too, and I've even seen stuff on social media. Let me tell you what I know. This is an mRNA vaccine. It does not get in your DNA. It doesn't change your DNA. It is not chipped. You're not going to be followed by Bill Gates. You are actually followed more by Bill Gates with your iPhone than you will be the vaccine. And I will try to make, I'm joking with you all, but you've all heard this. And know your facts. And yes, your arm is sore. And yes, people are having reactions to this vaccine. But let me tell you what that means. It means that your body's mounting an immune response. And you know what? I had that same reaction and I didn't feel good, me personally, for 8 hours. But I took acetaminophen and it lasted 8 hours. And I will take that any day over a stinking ICU and a ventilator. And I recommend you get this vaccine. Don't wait for the next one that you want. I recommend you get it. Sometimes they wear us down, right? And we're tired and we don't want to go down that road. But we had 2 people yesterday, and one of my NPs came to me and said, I had such a win today. I feel like I'm on top of the world. And I said, what happened? She said, a patient came in to me and said, I don't want that J&J vaccine because it's made from stem cells that are made from aborted fetuses. And I said, what did you say? I said, I've heard that on the internet. I've seen that the Archdiocese of New Orleans or Louisiana is recommending that you don't get the vaccine. But let me tell you what I know about stem cells. It is not from aborted fetuses. The babies are not aborted to have these stem cells. These were from 60 years ago. They're made in a lab. They are not part of aborted fetuses. And I recommend you get the vaccine. And this patient moved up her vaccine and is getting it tomorrow and is going to get the J&J vaccine. So she had 2 of those wins yesterday. So again, it does work. We just remember those people that give us the hardest time. Another strategy is ask, acknowledge, and advise. We do a lot of this with smokers, right? Are you smoking? How much are you smoking? It's tough to quit, but I advise you to quit. The 5 A's, we call them: ask, assess, advise, arrange. You know what I'm talking about. So I use this with vaccines as well. If you have questions, I'm happy to answer them for you. And you know what? It is a hard decision, isn't it? You're so worried about your baby and you have so much information. I often say to people, the amount of material that you read in a given day is what my grandmother read in a year. You are constantly bombarded with 15-second news cycles. I have spent 30 years studying these vaccines. I get that you're scared, but here's what I recommend and here's why. And let's come up with a plan. Ask, acknowledge, advise. Another communication model is what's called the CASE model. Corroborate, acknowledge their concerns. Oh my goodness, I was so scared when Dylan was little. I was scared. The varicella vaccine was brand new. And I remember thinking, I was an NP, you know, I had varicella as a kid. How bad is it? And then I read that we're seeing necrotizing fasciitis. We're seeing encephalitis from varicella. And that still today, even after the vaccination, 500 kids that are not vaccinated will develop this every year. So find a place where you can come together, that mutual respect. And then what I say to them is, I've spent 30 years studying vaccines. This is my baby. You know that. I actually had a patient say, I said to her yesterday in the clinic, I said to her, you do not need any shots today. She said, you would never let me need a shot. And if I needed one, you would have gotten me up to date. So, you know, that they come to learn that that's my personality. And I'm going to talk to you about your vaccines at every visit, and I review them with them. There's nothing new. You don't need anything. Great job. You're up to date. And I talk about what science says. Yes, that shingles vaccine that we now give out is what we call a recombinant vaccine. It's a dead vaccine, whereas the Zostavax vaccine that you got years ago was live. But here's what we know. It only lasted for 10 years. It had about 50% efficacy. What I now know is we have 7 years of data with this newer vaccine, and it's 100% efficacious across all age groups. Do you need a booster? I don't know if you'll need one. Many people say you might in the future, but we'll cross that bridge when we get there. I recommend you get the RZV vaccine on board today. Now, you're not going to like me tomorrow. This is what I say to them. Your arm's going to be sore. You may ache all over. You may have a low-grade fever. I'm telling you this because I want you to be prepared. And if you need to take acetaminophen, go ahead and take it. It's okay after the vaccine if you're uncomfortable. And so it's even okay before based on the latest information, but there's some mixed literature out there, and I steer them based on science. It's 2 doses. Let's get it done, and then you're done. And if we need to booster you, we will. But you ache because your body's mounting an immune response. There's also motivational interviewing techniques, which I know many of you are very familiar with, to resist that writing reflex. Otherwise, you run the risk of a vaccine hesitant parent commitment to the status quo. So understand their motivations, listen to them, be empathetic, and make your recommendation. You're not going to change them, but what you're going to do is partner with them to come to a mutually agreeable place. You don't have what it takes for them to do what needs to be done, but you can help to push them or to help them to get to make a decision. All right, so we're going to start getting into some of the things people are saying to you about the different vaccines and what you can say back based on science. But some of the things I've said to people over the years is help me to understand how you came to the decision not to vaccinate your child. Help me to understand so I know where to meet you and how I can best help you. Well, my X, Y, and Z provider, my grandmother said, don't let them vaccinate your kids. Do you know why she said that? Well, my mother had a seizure after a tetanus shot. Oh, well, let's talk about that. When your mom was little, we used to give something called DTP. It was called whole cell pertussis. Today, and that's why people had those febrile seizures after. Today, we use what's called a cellular pertussis. We don't see that with this newer, safer vaccine. Or every time I got the flu vaccine 50 years ago, I got the flu. Yes, that's because they made it with horse serum. And people got really sick. We don't make vaccines that way anymore. So asking a simple question, what made you decide? Sometimes you can then go ahead and rebut that. And people are like, you know what? That makes such sense. Okay, let's do it. I'm going to trust you. And those are the places that I feel like are such wins. Or tell me tell me why you're hesitant to give your child 2 shots together. Well, it's going to overwhelm their immune system. Well, this is where we talk about the door handle that you just touched to walk into this clinic actually has more antigens on it than 2 shots combined. And your child's immune system is programmed to respond to multiple insults at one time. These were studied together. Let me go over those studies with you. Again, I hope I'm just giving you some dialogue that you can have with your patient. But make sure in those vaccine hesitant or refusers, you document, because there have been cases, medical malpractice cases, where NPs have been sued for failing to offer a vaccination that was recommended. So you want to make sure that if you recommend it, that you document that they're refusing. And as I told you, there's a Z code. You can just look up in your EHR. You can Google it online. Vaccination refusal by parent, vaccination refusal by patient. And I have them sign. And there are forms that you can get at the CDC or ACIP that are refusal to vaccinate forms that you can have them sign. I have them sign directly into the EHR system. And what I also do by making it a diagnosis and a Z code, it then pops up on the problem list, so that at every visit and every physical, we're going to encounter that vaccination refusal, and we're going to bring it up again. You can even set reminders in the chart that says, please talk to parent about these vaccines. And so we do all of the above to optimize, to protect ourselves, and to also let that parent know that we're pretty serious. Now, I'm going to tell you a story about a patient of mine whose mom refused to allow her to get the HPV vaccine. And I've been caring for this young woman since she was a little girl. She's now 30. And we had conversations every well visit. And mom said, nope, no HPV for her. No way, no how. Well, once she was 20, she came in to me and she said, I'm really nervous because I just found some lumps on my vagina and they were HPV, and her pap was a low-grade HPV. It was a low-grade SIL that day. So she had obviously been exposed to multiple strains of HPV. And she said to me, do you think that the HPV vaccine would have prevented this? And I said, we'll never know. I do know that if we get it on board before someone is before sexual debut, it's almost 100% effective in protecting against those strains that are the most common and that are in the vaccine. But you know what? We will never know. And she said to me, she looked at me right in the eye and she said, I remember every conversation with you telling my mom to get this on board and that you recommended it. And she said, and I'm so angry. And I want to tell her that I'm angry, but I can't, because I cannot tell my mother I have genital warts and an abnormal pap. So with that said, I get it. And I get that it's really scary for some parents. We can only do what we will do. But she said to me, vaccinate me, please, and get it started today. And I said to her, you have to recognize that it's not going to make this go away, but we can at least protect you against some additional strains. And so, that story just sits in my head because that is the reality. And I've had a lot of teenagers who, as soon as they turn 18, say, give it to me. I have every right. And I'll say, I'm in a bad situation because I do see your mom and I'm going to give it to you, but I just think it would be good for you to have a conversation with your parent, but you don't have to, but I'm going to give you the vaccine. But just know that I also see your mom and I know how she feels about this. So I think it's really good for you to have a dialogue. So demonstrating the impact of vaccine confidence on immunization rates and outcomes is imperative. I love to have some of these statistics, not for patients, but I think, it really speaks to why you and I are fighting so hard to do what we do. For every $1 we spend on vaccines, we save between $11 and $42 in disease-related costs. We know that. We know that in 2019, for every dollar spent in that year, it saved at least $10. And you can see the net savings in terms of direct costs, but payers' perspective, societal perspective. So in my state, I told you every vaccine we have for 0 to 19 years old, up to 19, comes from our state. Well, how does the state have the $35 million to spend on them? Every insurer, and there are 3 main insurers, there's Blue Cross, there's Cigna, and there's Harvard Pilgrim. Those 3 insurers give our state $35 million, and then the state buys the vaccines from the CDC and gets the discount and then gives them to all the providers to give to kids. And, you know, I've talked to the insurers and I say, why do you do this? And they say, because we know we either pay now or we pay later. I'd rather pay in terms of prevention than having to treat these diseases. Part of my doctoral work was to go into clinics. So my doctoral capstone was this. I went into NP-owned clinics and I said to the NP owners, tell me what your vaccination rates are for people 65 years of age and older for these 6 vaccines: Tdap, flu, PCV13, PPSV23, Zostavax, and Shingrix. So ZVL and RZV. I said, tell me what you think your vaccination rates are. And they told me. And then what I did was I went in, they ran a report for me for all their patients 65 and older, and I data mined over 1,000 patients. And I looked at vaccination rates, and I'll tell you, they were nothing like the NPs thought that they were. NPs told me they thought 70, 80%. What did I find? 10 to 30% vaccination rates. So why do I tell you this? Because unless you're running reports, unless your clinics are data mining, we all think we're doing better than we are, me included. And when I look at some of our rates, I'm like, how can they only be 80%? Well, that's because we're good at the people we see. We're not so good at the people who don't come through our door. So running your practice immunization rates, data mining. How do I do this in a clinic? I partner with 2 academic institutions, now just 1, but in the past I've worked with 2, and they send me master's and doctoral students who need projects, and I have them come in, and every year we do a project. One of them always involves vaccines. They data mine for me, and then they set up a plan on how we're going to improve those records. It's cheap, they're free, and I need free labor, and they need a capstone, and they need a faculty mentor, and I can be that person. So that's how we improve our vaccine rates. And then their job is to present what they found and what their recommendations are. And then we put a workflow process in place to improve the vaccines. This year, I have 2 fellows in my clinic, fellow NPs that are in a fellowship, and they wanted to improve vaccination rates for HPV in 27 to 45. So right now, I've run a report for them. They're data mining, they're looking at the numbers, and then they're going to make a recommendation in our workflow process to try to improve the vaccination rates in 27 through 45. And regular staff meetings, having those vaccine champions. And you can certainly, if you've got parents who want to sit down with you and talk to you about vaccines, you can actually bill based on time now. And we know that Medicare also allows you to do that now as well. So let's talk about some tips and some talking points for common scenarios. And I told you that I would give you some responses that you can use when people say certain things to you. That's what we're going to walk through now in our last 20 or so minutes. So here are some of the concerns I hear every day. And just when I think I figured out what their concerns are and how to respond, they come up with something new. So think about these statements and and I'd love to know, do you hear these as well? Overloading of the immune system with too many vaccines at one time. You're giving my kid too much too soon. I've heard about autism and other neurologic side effects. I'm worried about the mercury that's in these vaccines and the exposure to both mercury and aluminum. Oh, I heard that there's formaldehyde in that injection, and formaldehyde is what they store dead animals in for labs in our science classes. Natural infection is safer than vaccinations. Most of the preventable diseases don't even exist anymore. Why do I need to protect people against them? Why do you need to give that to my kid? My fill in the blank told me not to let you vaccinate my kid. The government has no right to tell me how to raise my child. And now what are we hearing? Stem cell issues from aborted fetuses. That's one we're now hearing. I'm trying to think of what else. Oh, it's changing my DNA. And so those are just some. So you want to be prepared. Let's talk about some really cool facts. I love these slides. I'm not going to spend a ton of time on them. You have them, take them back to your clinics and use them. So the person who says, I don't want you giving my kid multiple vaccines, it's going to overwhelm the immune system. Your baby's immune system has the capacity to respond to thousands of antigens at the same time. We want their immune system to do that. Children are exposed to hundreds and thousands of antigens every day. The toys they play with, the doorknobs, daycare, playground equipment. Now, here's what I love. I say to them, Mom, I know you were born in 1984. Look at the vaccines that you got. In the vaccines that you got in your childhood, you received 3,041 antigens as part of your vaccine. The child's vaccines today, all of them, even though there are more vaccines, they're only getting exposed to 181 antigens. Why? Because the vaccines today have better carrier proteins that get that infection into the cells, which then allows us to mount an immune response. Folks, I was born in 1966. I got 4 vaccines: measles, oral polio, diphtheria, tetanus, pertussis, DTP, and smallpox. I think those were the big 4 that I got. And by the way, in those 4 vaccines, I was exposed to 30,000 antigens. So today's vaccines contain fewer antigens. All right, too much, too soon. Vaccines do not overload the immune system. Our goal is that your child is protected against the disease before they're exposed. And I use the analogy, the worst time to call for car insurance is when you're sitting on the side of the road in a car wreck. We want these on board before your child is exposed to protect them when they do get exposed. The Lancet story alleging the link between MMR and autism, that was a fabricated article. It was based on 4 children, and he completely made it up. He's lost his license to practice medicine in the United Kingdom. And what I explain to people is, you know, when I was on maternity leave with my son, and I use this analogy, every Wednesday I would start to eat my breakfast and the darn trash man would come. So if I were to think about it, in my head, it was every time I eat, the trash man comes to collect the trash and the dog barks. Well, it has nothing to do with me eating breakfast. Just because the rooster crows in the morning and the sun is coming up, the sun is still going to come up whether the rooster crows. So giving the vaccine, the MMR, we used to give it at 15 months. People thought it was linked with autism because we would pick up autism around 15 to 18 months. We're going to pick it up whether they got the vaccine or not at 15 to 18 months. So just because the two happen at the same time doesn't mean that one causes the other. Thimerosal, that's the mercury containing preservative, has never, ever been part of the MMR vaccine, ever. It's never contained any form of mercury, and the mercury that's in the thermometer is the neurotoxic methyl mercury that has never been in any vaccine. The mercury that's been in vaccine in thimerosal is ethyl mercury. It is very different from the neurotoxic methyl mercury that's found in thermometers. So the only vaccine where there's any thimerosal any longer is in the multi-dose flu vaccine. So I tell parents we don't even have that on site. Every vaccine I have has 0 preservatives in them. Well, what about aluminum? This was fascinating to me. Aluminum exposure during an infant's first 6 months of life, when you look at the amount of aluminum in vaccines, it's 4.4 milligrams. When you look at the amount of aluminum in breast milk, it's double that found in vaccines. So please don't tell people to stop breastfeeding, But I'm just showing you this, that the amount of aluminum in vaccines is less than that that's found in breast milk. It's less than that in formula and soy-based formulas as well. And a lot of people drink milk and babies drink soy-based formula. There's more aluminum in those formulas than there is in vaccines, and there's more aluminum in breast milk. What about formaldehyde? Formaldehyde is used to inactivate the viruses that are found in the vaccines, the flu, the polio, the tetanus, the diphtheria. It's diluted during the manufacturing process. And by the way, the quantity of formaldehyde found in infants' blood is much greater than that contained in any individual vaccine, even kids who are unvaccinated. This is naturally occurring formaldehyde. It's found in all humans, and it's used to synthesize purines, amino acids. It's used to inactivate viruses, and it's not formaldehyde like people think about in laboratory rats, etc. So natural infection is I would rather have natural infection. I say to parents, you'd rather your kid have meningitis than get a meningitis vaccine. So not vaccinating puts your child at risk. I've actually tried to use the community analogy, but people have said it's not my job to worry about the community, which really makes me so sad. But I can't go down that road. So now I don't mention anything about protecting the community. I just talk about them and their kids. So why do we vaccinate? We, in this 9-year span, prevented 322 million illnesses, 21 million hospitalizations, and almost 1 million premature deaths in kids. This is kids alone. So my fill in the blank said not to let you vaccinate my baby. Who gave you that recommendation and why? And give them reliable sources. The government doesn't have the right to mandate vaccinations. They absolutely do. They don't do it often. Some states do it more than others. But yes, they do have the right to mandate if they chose to. And God, not immunity, protects my child from illness. I've heard that one as well. And what I say to parents is, you know what? God has given us life and has given us breath and has given us brains. And the fact that we've used those to formulate vaccines, there's nothing in any of the religious doctrines other than Christian scientists. And I do have a family that's a Christian Scientist family. Every other religion says vaccines are permissible and are recommended. The use of fetal cells in vaccine production is immoral. So there were cell lines developed over 50 years ago that were derived from aborted fetal tissue to develop the cell lines for Hep A, polio, rubella, and varicella, as well as the J&J vaccine, but to develop those stem cells. And so they are now just being fabricated in the labs. These are not aborted tissues that are used to create a vaccine. So some Catholics may refuse, but the Vatican says the use of all available vaccines is morally justified. So that's what I use with them. And the use of vaccines containing pork gelatin is wrong. You may hear that from individuals who are who practice Islam or Judaism, and both of those religions allow vaccines to be used even with pork gelatin. So I hope what I've done is given you some ways to counter what people say to you about the different vaccines. And I love those slides. And now you've got the science behind a lot of what people are saying to you to counter their thoughts. I do want to give you a couple of immunization scenarios, and then we're going to wrap this up. So a father of a 12-year-old girl in no uncertain terms says to you, it is his job to protect his daughter from any and all harms. And he jokes, someday in the very distant future, that will include protection from bad boyfriends. But today, he goes on, it includes protecting you from giving her the HPV vaccine. It's dangerous and she doesn't need it. So what do? Find a place of agreement with dad. What have I said? Because I've had this. I've had a father who says in no uncertain terms, what I say is, you know what? It's a really hard place to be as a dad. And I'm sure you've heard a lot of mixed messages. And so here is, so corroborate, agree that it's tough it's hard, and that you've heard some of those things today. But let me tell you what I know about this vaccine. This vaccine has been used now in 110 countries. Over 130 million dosages have been given. And despite what you may have seen on social media or heard, there is no signaling. And you know what, sir? It's not just here in the United States that we're watching this. We're watching this all around the world. There's no signaling. In fact, you know what we know? We know that this vaccine has already begun to reduce cancers, oral pharyngeal cancers. We know that it is 100% protective against high-grade cervical cancer if it's gotten on board before sexual debut. We know it reduces anal cancer by 78%. And there's going to come a day, sir, in the future, I suspect, that women who have had this vaccine are not going to need pap smears nearly as frequently. We know it's a cancer-preventing vaccine. The other thing I'll say is, if I had a breast cancer vaccine today, would you give it to her? They always say yes. I'll say, sir, there's nothing different with this vaccine. Nothing at all. This is a cancer-preventing vaccine. So find a point of agreement, tell them what you know, give them the science, and say, this is going to protect your daughter against cervical cancer. And the good news is that this vaccine is safe, that we are not seeing any signaling. And, you know, just to give them the best time to protect her is now. She's going to mount a good immune response. And the last thing I now say is, if I give this vaccine to her today, it's only 2 shots. It's 1 today and 1 in 6 months. If we wait, it's 3 shots. And a lot of kids have said, Dad, can I please get it now? I don't want 3 shots. I'd rather have 2. Make sure you understand what constitutes the reason to defer a vaccine. A moderate to severe illness is a reason to defer, but not a mild illness. So I hope what I've done is given you how to apply that case model. In the past decade, there's been a lot of research. The studies have looked at these vaccines. I know it's a hot topic. I just spent the last 3 years in my doctoral program working on just this. Let me tell you what I know. There's also some scenarios here for you and your team on influenza, on different combination vaccines. I promised you today I would give you resources, some really good resources. All of your vaccine companies will provide resources. There's some here for you. There's also some from the CDC's AFFIX program. I've given you the reference to the refusal to vaccinate, and people who have maybe developed diseases that could have been vaccine preventable. The AAP, Communicating with Families, has a great resource. They also have Why Immunize Kids out there. They have some videos, fact sheets, and various handouts from the Immunization Coalition. I've also put together this list of American Academy of Peds, Immunization Action Coalition, and NAP has some great information as well. And then last but not least, some scenarios for role play. Parent mentions 12-month-old son. Isn't that the vaccine that causes neurologic problems? How do you respond? Married couple brings their 4-month-old daughter in. Is it safe to give so many vaccines all at once? Use the case model, corroborate, tell them about you, tell them what science says, and explain and advise, and stick with your recommendations. All right, everyone, we are wrapping up. And I've given you all of these points that you can talk to. They've really evolved. And I hope that this has really been a helpful lecture for you today. And I look forward to answering your questions live when I join you after this lecture. Thank you so much. Have the best day. Thank you.
Thank you again, Dr. Wright, for that great presentation. We've had a lot of questions come in, so we're just going to try to get to as many as we can.
Okay.
All right, great. One of our participants asked, have you had any issues with insurance companies not covering Tdap every 10 years in adults?
So the answer is no, we haven't. And because the CDC made it a universal recommendation and said you can use the Tdap every 10 years as that every 10-year booster, it is, and they also said you can use it with wound management. Insurers are required to cover it. And I will tell you, we've been doing Tdap every 5 or 10 years, depending upon wound management, ever since it came out anyways. It was the one time in my career that I totally ignored what the CDC said to do. We've only offered Tdaps in our clinics for the last 20 years and are not seeing any issues with reimbursement.
Perfect. Thank you so much. We had another participant ask, what do you think about refusing to take on a patient who does not agree to get vaccinations due to a belief that you are not providing safe care for potential lawsuits in the event that the child gets sick from diseases that are treatable with vaccines?
So this has been a really hot topic, and I know that the American Academy of Pediatrics has taken this topic on, and what they've said is we do not encourage that you fire or terminate your relationship with a patient, and we don't encourage that you not take people on. But what they also said was we recognize that pediatricians have a role to play, and a couple of my colleagues, pediatrician colleagues, will actually have their receptionists screen patients that call for new patient visits. And they ask them at the window and at that initial phone call, do you vaccinate? And if they say no, they'll offer them a strategy of, well, we do vaccinate here. We'll give you 6 months or we'll give you a year to get your child vaccinated. If you choose not to do that, we will no longer be able to provide care. So I don't do that because I feel like if anyone's going to get them to vaccinate, it's going to be me because I am a darn tick on a deer. And you are going to hear me at every visit say to you, I recommend that you vaccinate your child. And you're going to hear me at every visit say, I've just dropped in this code, this Z code, refusal code, that we have discussed the importance of these vaccines, and that despite this discussion, you're continuing to refuse to have your child vaccinated. I've had people rip me apart because I use the word refuse. They want me to change it to denies. You know what? At the end of the day, it's semantics. You're not vaccinating your child. I've recommended, and I say to people, I will very much respect your ability to choose what you think is best for your child, but don't come back to me 6 months later when your child has a vaccine preventable illness with your malpractice attorney and say to me, I never told you, because this documentation, this Z code in your chart and your signature below that Z code constitutes that you and I have had this discussion. So I know that the CDC puts out a declination of vaccination form. We don't use the form because we use a touch screen in our clinic where you can actually sign into the touch screen. We drop in the Z code. We have a quick text that we've developed, and we have them sign that they are vaccine refusing. I will tell you, I don't do it with every vaccine out there. I do it with children, not as much with adults if they refuse the flu shot, because otherwise 35% of the population I'd be having to sign. But if they refuse pneumococcal and they refuse the shingles vaccine, I am asking them to sign for that refusal.
Okay, great. Thank you. And I know you had those Z codes also for the refusal.
Right. I'm gonna just look at them, Terry, because I don't remember them because I always just search them in our database. I don't remember numbers at all, but it's Z28.21, and that's vaccination refusal by patient. And then there's Z28.82. That's vaccine refusal by caregiver or parent. So those are the two codes we use most often. And what I like about those codes is they become part of the problem list, right? So every time I see a patient and I see that Z code, it's just a reminder to make sure we discuss the importance of those vaccines. And again, I will respect your wishes, but don't come back and tell me I never told you. There have actually been a couple of malpractice cases filed against nurse practitioners for failing to recommend the pneumococcal vaccine and someone going on and developing invasive pneumococcal disease. So it is out there, and it's something we just have to be aware that we need to do everything we can to protect ourselves while the patient is doing what they think is best to protect themselves.
That makes sense. Thank you. We did have someone write in about the vaccines and wanting to separate vaccines. They have a lot of parents very concerned about autism, and they ask specifically about the hexavalent vaccine, that you can't separate. There are going to be some people that don't agree to take it. How would you approach that?
Right. So there have been requests over the years, as you all know, to break apart vaccines. One of the best things that's happened is that the manufacturers have stopped creating individual vaccines. I think it's the best, because what I can say to people is, I'm sorry, but that vaccine is unavailable in a single entity, that we just can't give it to you because it's just no longer available. The other thing I say to parents is this vaccine that you are seeing with multiple components in it has been pentacell plus hepatitis B that we've been giving in separate vaccines. The only difference here is it's 2 less or 3 less shots. And what I also tell parents is these components were studied together. And yes, their legs may be a little more sore, or yes, they may have a low-grade fever, but at the end of the day, what we're doing is we're reducing shot burden. And we know that the number of pinches kids need to get affects vaccine hesitancy. And so when parents will say to me, I want to follow Dr. Bob's schedule, I want 1 vaccine a month for the first 2 years my kid is alive, what I say to them is, we don't know the efficacy of separating out those vaccines and doing 1 a month because they weren't studied that way. But if that's what you want to do, I will do my best to do that. But what I will say to you is almost every child falls short, because at 9 months, when that kid sees our sign, they're screaming by the time they get through the door, because they know every time they walk through the darn door, they're getting a vaccine. So I know parents are asking for it. There's no evidence to support that you're overwhelming the immune system. And really, when Terry and I got together to talk about making this lecture available to you, one of the things we wanted was for you to have a scientific answer, so that when someone says to you, you're overwhelming my child's immune system, you can actually say, well, you actually did great, because the amount of antigens you got when you were a kid is actually double what your child got. I wanted you to have those scientific facts so that you have a retort. Now, I also said to Terry, we also have these retorts, and every time we have an answer to something, they figured out something else to come up with. And so all we can do is remain calm, say, I understand, find that point of corroboration where you can agree on something. And I always say, I'm a mom. I remember being in your shoes, and I remember how scared I was about vaccines. Am I doing the right thing? But as a scientist who's now spent 30 years studying vaccines, here's what I can tell you. And this vaccine is safe. So that's how I address the issue.
I think that's a good point about finding a point of connection. One of our participants asked about particularly adults' refusal for flu vaccine when they tell you, I got sick. When I got the flu vaccine before I got sick. What's your response that works?
Oh, I want to record my voice every flu season. I just want to have it like projecting out into the waiting room, because I feel like I say this all the time. And what I say to people is, you know what? You're 65. 40 years ago, the flu vaccine was made very differently. It was actually made from horse serum, actually. And so, yes, you may have gotten sick 40 years ago, but today's vaccine is made very, very differently. So you can't get the flu from the flu vaccine, but I'm giving you a vaccine that's triggering your body to mount an immune response. So you need to take care of your body. When you get a vaccine, you need to sleep, and you need to eat healthy and take some vitamin C, drink some vitamin C, and be good to your body for 48 to 72 hours after a vaccine. You know, when I got my COVID vaccines, the night before, I went to bed early. I slept, I hydrated, I ate well around that vaccine. I think it goes a long way. And so what I say to people is, I get that you got the cold, but you would have gotten the cold anyways. It's like that darn rooster crowing. just because you had the vaccine doesn't mean it was the vaccine that did that.
That's great. Thank you. I appreciate that. One of the participants brought up about state charges for immunizations if they're sent through the parental insurance until age 26. So in the case of the young girl who developed the HPV infection at age 20 and asked for the HPV vaccination, it would show up as a charge on her parental insurance. Any thoughts on that?
Yes. So my son is 23. He's on my health insurance. We've been able to call the health insurance and have all EOBs directed to him. I no longer get any EOBs, and he can have those electronically online. So what I don't think a lot of people realize is just because you're on your parents' insurance, there are things you can do once you turn 18 such that your parents are not notified about your medical issues. And so all people need to do is call up their health insurance, tell them they want the EOBs for their care to be directed to them, that they do not want their parents seeing them. The other option, particularly for the HPV vaccine, is that Planned Parenthood will look at it as an emancipated condition and has vaccines available for individuals who want the vaccine when a parent may not want them to have it. So that is another option for people who are worried about the EOB, is to connect up with a local Planned Parenthood and get the vaccine through them as well.
That's a great point. Just a couple of more questions here. Someone asked, what if someone has a pork allergy? Are there any contraindications in vaccines?
So there are no pork allergy contraindications. In fact, the CDC has not made any recommendations regarding gelatin or pork as a contraindication to any vaccines. Within the last couple of years, the Allergy Association, the American Association of Allergists, have actually come out to say food allergies are a very rare source of any problems with vaccines. And you've seen that over the last decade, the egg allergy has been removed from the flu warning, as well as the warning regarding MMR. So in terms of food allergies, they're really not looking to play a role and are generally not contraindications to any vaccine at this time.
Perfect. Thank you so much. Also, one of our participants asked, and I get this sometimes in clinic, how do you respond to the question about syncopal episodes seen with the HPV vaccine?
Yeah, so what I say is this. So when they configured the HPV vaccine, in order to carry the 9 antigens, what they needed to do was they needed to bump up the carrier protein. So it's a higher amount of carrier protein. You know, we talk a lot about this in the world of vaccines, that people think 9 antigens is better than 4, and it is. But the more antigens you add to a vaccine, the more dilute the vaccine can become. And what they wanted to do is ensure that when they added the additional 5, that they weren't losing the benefit of the first 4. So they had to bump up that carrier protein. So why am I telling you this? Because that carrier protein is acidic and it stings. And just like a blood draw, big boys fall very hard, right? And adolescents often have lower blood pressure. It's a vasovagal episode. We know that it occurs more often in teens. And so what I tell them is it's not harming you. It's just that when you felt the pain, you vasovagaled and down you can go. So what we try to do is when I have an adolescent coming in who needs vaccines, we try to get them on board before I actually finish my visit with them. Actually, before I even start, let's get them over with, because they often pout anyways because they're getting vaccines. So I'll say, let's get them over with, and then you and I can have a good conversation, and I can watch you while you're here, and then you're ready to go 15 minutes later. It is a vasovagal reaction.
Okay, that's a really good approach to do those vaccines first. Great. Thank you so much, Wendy, for being here with us both of these days. You've just done a tremendous job. I know you're an incredibly busy person.